Our menstrual cycles are actually a vital sign, believe it or not. So oftentimes, women of all ages, whether you're a teenager or you're in your 20s, 30s, 40s, or even beyond, and still trying to figure out what your cycle is trying to do, we dismiss it. We say, oh, it's just that time of the month, I'm just having cramps. Well, it doesn't have to be that way. And I want to spend the next few minutes talking about how we can monitor our menstrual cycles, understand if they're working for us, not against us, and what we can do to support a healthy menstrual cycle.
Over and over again, I meet women who simply dismiss their cycles, tracking their cycles, or even kind of paying attention to how their cycles make them feel. I meet teenagers who say, it's just that time of the month. Why do I need to worry about that? Or women in their 40s who dismiss it as perimenopause, hands in the air, thinking there's nothing we can do. Well, that could simply not be further from the truth. And in the next few minutes, I really want to lay out what a healthy menstrual cycle looks like, some of the signs and symptoms that you should be paying attention to know that your cycle might need a little bit of support, and then my favorite ways to support a healthy menstrual cycle. As many of you know, I spent a lot of time training in both Western and Eastern medicine, and one of the beauties of merging the two together is that our toolbox for helping things like your menstrual cycle is immense. There are so many things we can do, and that's the good news. Now for the bad news though, you're going to have to pay attention, you're going to have to take notes, and you're going to have to work a little bit to identify what really may be going on with your menstrual cycle. All right, a healthy menstrual cycle, here's what it looks like, and we're going to tackle it from a couple of different perspectives. First of all, you typically have at least a 28-day cycle. That's the average. That's kind of considered the norm. Now, each of us are individuals, right? So we're going to differ a little bit. Some of you might be at 26. Some of you might be at 32. All good. No reason to panic. But if you're shortening to under about 24 days, which means your cycle is repeating itself every 24 days or so, that's too short. And if it's going past about 32 to 33 days, that's too long. And both of those are issues because it means your hormones are simply not balanced. Now, when we're in that 24, 26, 27, 28 day cycle, we usually have the right amounts of estrogen and progesterone to balance and maintain a healthy cycle. So one is the length of your cycle. And remember, the first day you bleed is actually day one. Everybody asks me that, where do they start? But day one is the first day that you actually bleed, and then you start counting from there. All right, the second thing we need to look at is the nature of your flow, right? Is it super light, like you barely use a tampon or a pad or a cup? Or is it very heavy where you're soaking through? I had a patient just yesterday who said she has to wear a Depends and one of the most, like the thickest tampons or pads to be able to get through the first day or two of her period. Too heavy. We shouldn't be seeing blood drip down us or having a lot of issues where we can't leave the house when it comes to a healthy cycle. So your average flow, or what flow should really be looking like, is where you use anywhere from 4 to 6 tampons or pads per day. If you're using less than that, your hormones may be depleted. You might be in a deficiency state. If you're using more than that, you may be in a state of what in Chinese medicine we call liver stagnation, where your hormones are not getting metabolized. They're just building up over there and simply not doing the work they need to do. Okay, so we've talked about the number of days, flow. Let's talk about the length of flow. Usually it's somewhere between 5 to 7 days. Maybe you could push it on the borders of that, right? Maybe 4 to 8, but it really shouldn't be shorter than that. And it honestly shouldn't be much longer than that. So if your cycle's lasting all month long, that's an issue. That's a red flag. Time to check your hormones and understand what's going on with your cycle. All right, after that, we need to look at things like pain. What's happening with you? Does the cycle come on and go about its way and you can go about your day? That's the goal here, and that's really what we want to dive into and make sure you've got a toolbox to make sure that your days of having a period are not days that you're chalking off to days you can't get anything done. So they should not be painful. They should not hurt when you're having them. And it's really important to pay attention to some of those signs and symptoms. All right, after pain, here's another one, really important one, your mood. What's happening? Are you going into a deep depression the week before your cycle or having anxiety? Either the week before or the week after? that's another sign that your cycle's not healthy. Something is going on with your hormones. Now, I've talked a lot in a lot of my videos about checking your hormones and understanding where they are and the importance of using them just like you would use blood pressure, temperature, respiratory rate, your HRV, and so much more to track and understand what's going on with you. So if you don't want to listen to the rest of this video, that's fine. But here's what I am imploring you to do. Start understanding how long your cycles are, how heavy the flow is, and then track yourself. What are you doing the week before, the week after a cycle? How do you feel? And if you're losing days to your menstrual cycle, well, please stay tuned. We need to continue to dive more deeply into this topic. Okay, so now you know what a healthy cycle looks like, and we also know what a relatively unhealthy or irregular cycle might look like, right? Let's get into what we can do, right? We just don't want to talk about all the bad stuff. So let's talk about what we can actually do. Now, I can start with diet and work my way all the way through mind-body regimens. But I'm going to give you the Cliff Note version of this because I know you're probably just as busy as I am. And we expand on many of these ideas in some of the other videos right here on this channel. So please be sure to check those out. Now let's talk about diet. I want to talk about diet first. And again, I told you I'm doing the Cliff Note version. So number one thing you need to be thinking about with diet when it comes to a menstrual cycle that you've been able to identify is simply not where it needs to be, is we need to start moving towards an anti-inflammatory diet. Now you're probably tired of hearing those words, but inflammation is sort of the undercurrent of what's happening with hormone imbalances. Here's where you should start, all right? Your number one starting point: ditch the sugar, ditch the refined and processed foods. All of these preservatives are totally disrupting hormones. So skip the fast food lines, go into the grocery store and get super comfortable in the kitchen. And I have been passionate about putting videos on this channel that show you how to really nurture and feed yourself when it comes to balancing your hormones. So please, please check those out. But again, sugar, fast foods, processed foods, junk foods, that's your starting point. Starting point number two when it comes to diet is to up the fiber. We need a ton of fiber to metabolize hormones, whether that is more fresh fruits or leafy greens. Those are things you want to bring in at least 4 times a day. 1, 2, 3, 4. If you guys can remember that, it doesn't seem impossible. We can all bring that stuff in at least 4 times a day. And if you're having a lot of issues with your cycle, go ahead and bring in some supplemental fiber. You can do a tablespoon of ground flax seeds or chia seeds, tablespoon of psyllium husk. Yes, you can even do fiber gummies. It's okay. Don't tell my husband. He's a dentist. He hates the gummy vitamins, but sometimes a girl's got to have her gummies. But moving on from that, let's move on. Wait, we got to talk about one more thing when it comes to diet. I can't forget this. And you're going to be super mad at me, but please don't be mad at me. You have to lower alcohol. Alcohol turns to sugar at the end of the day. It causes an overgrowth of yeast. That in turn completely destroys the entire hormone cycle, leading to so many of the things that we see: PCOS, endometriosis, and more. So alcohol is the other one. Okay, let's keep going. Let's talk about some of the supplements and herbs that I have seen work and are so big in the world of Chinese and Ayurvedic medicine in terms of really helping women balance their hormones. These are formulas that honestly have been used for thousands of years. Number one is magnesium. Magnesium I have called the miracle micronutrient. Helps metabolize estrogen, supports progesterone, helps out the thyroid and insulin and blood sugar, and so much more. Think about starting with about 200 milligrams or so of magnesium nightly. I like a mag chelate or a mag glycinate. If you're having trouble sleeping, you can go to a 3 and 8. And if you're having trouble going to the bathroom, you can do a citrate. But pick a magnesium. Just pick one and roll with it. The next one that I feel like is so important are your methylated B vitamins. Methylated B vitamins, again, helping with this metabolism of hormones. So B in the morning, magnesium at night. All right, we have sitting here your omega-3 vitamins, right? I've talked a lot about omega-3 vitamins over the years. Omega-3 fats are essential for the reduction of inflammation. And they actually, especially for all of you girls who might be having an issue with painful periods, we know omega-3s help to take that pain down. So that's another one that I would think about using as well. Let's talk about one more while we're talking about painful periods. Evening primrose oil, again, helping with that cramping, sort of period pain that keeps you at home, I would start at least 1 gram of evening primrose oil every day. All right, I got just one more. Let's talk about chaste tree. Now, one of the biggest drops, and I talked about this in my latest book, The Hormone Shift, is that when women are experiencing hormone imbalances, oftentimes one of the primary hormone drops is first progesterone. And it doesn't mean you have to go straight to hormone replacement therapy, right? But something like chaste tree, right? Chaste tree or Vitex, which is an herb, been around for thousands of years. That actually indirectly helps to boost progesterone levels and can even out these hormone imbalances, helping us with the nature of our periods. Okay, hopefully that's enough starting steps for now. Thinking about diet, thinking about some of the things you can take, recognizing what is a healthy or an unhealthy menstrual cycle. I am going to continue to talk about this. This is so important, and I'm so passionate about this because so many of you are out there suffering. We're going to talk more about the mind-body component of a healthy menstrual cycle in the next video. But don't forget to like and subscribe. And thank you guys for staying on this channel.